reported last July, we've had an exciting and busy year both here in the U.S. and in Sierra Leone. Over the past 12 months, we've continued to work on projects in the northern province of Sierra Leone, specifically in the villages of Manoko, Masheri, Masati, and Rokon.
Our supported projects include a medical outreach in Manoko, community enhancement activities, spiritual nurturing, and of course, the construction of the Doris Acton Community Health Center, which was dedicated on June 4th of this year. To make sure we've given you all a complete and succinct summary of our accomplishments over the past year, we've prepared this short video presentation. We hope you enjoy it.
In 2006, Doris Acton traveled to Sierra Leone to begin developing specifications for a medical outreach to be established in the rural northern province. In consultation with the United Methodist Church, the village of Manoko was selected as the site for this project. Since that time, over 4,000 patients have been evaluated, and more than 30 U.S. medical personnel have assisted with the outreach, which operates every Saturday. During the past year, 2 doctors and 7 nurses, plus 2 nursing students, visited Manoko on teams sponsored by the Foundation. The project has progressed from its humble beginnings. Doris Acton.
What has really happened, what has really developed as kind of like this little community health clinic has really expanded into a community health development project. We have gone beyond just looking at healthcare in the form of illness and looking at what does it take to create a well community, which is taking care of schools, taking care of churches, the development of latrines, of water wells. And what has been really exciting is that each person who comes on a trip to Sierra Leone really has a chance to look at the work being done and then utilize their expertise into saying, have you ever looked at this particular thing? Or if we teach health in the schools, think how that will impact the community. So it has really gone beyond that, and each person has been able.
In addition to weekly medical evaluations, treatment, and referral, the outreach clinic serves as a distribution center for insecticide-treated bed nets, Feed My Starving Children emergency food assistance, and layette kits for new mothers. The clinic also manages a deworming program that is administered at the Manoko Primary School every 6 months as part of an effort to reduce school absences from parasitic infections. The deworming program is also a chance for the non-medical team members to participate in providing medical outreach services. In February 2010, the outreach clinic also coordinated treatment for 40 cataract patients who traveled to the Kissy Eye Hospital in Freetown for surgery. Here, in his own words, is the reaction of one patient leaving the hospital after a procedure which allowed him to see for the first time in over 10 years.
He is saying he actually appreciates what the Americans have done in terms of getting him back in sight by way of performing the operation which they, the Americans, have paid for. So he's grateful.
Okay.
We believe that building a healthy community involves more than just treating patients who are sick. Community education and providing essentials is also important. In January, our team focused heavily on community education, visiting every home in the villages, and spent some time speaking with residents about hygiene and wellness concepts.
It's important that you take care of your wells and keep them secure. And not let the children play on the wells and not let the animals be near the well.
Our January and February teams also distributed soap and shoes to families to help prevent infectious diseases, and they helped construct additional clothes racks to provide a safe place for residents to dry their clothes rather than laying them on the ground. Of course, healthy communities also need a solid foundation of quality education. While Manoko does have a primary school, the 3 teachers who serve there are uncertified volunteers. In March of this year, the only certified teacher in Manoko died of an uncontrolled infection. In May, we met with the volunteer teachers and representatives of the local Polytech Institute in McKinney to develop a plan for providing advanced training for the Manoko teachers.
Okay. So we'll go back home and we'll see what we can do.
Thank you.
As a Christian organization, we are also working to nurture the adopted community spiritually. In January, Pastor Don Esslinger from our home church, Normandale Highlands United Methodist Church, performed 50 Christian baptisms in Minocco. With just a volunteer pastor, residents in these villages have to queue up for baptisms by the local district superintendent or have them done while our teams are in country. Speaking of the local pastor, during the past year we learned that Michael Kamara has been accepted into a seminary program. This will, however, require him to live in Freetown for 3 years, creating some hardship for his family. We are excited for Michael and are working to support his efforts to become fully ordained. Finally, our January and February teams helped complete some overdue renovations at the United Methodist Church Parsonage in McKinney, which serves as our home in Sierra Leone. The team was able to put down new flooring, improve the bathrooms, and add a fresh coat of paint to the exterior.
Those of you who attended our fundraising event last year know that our feature project for the year was to construct a permanent health center in Minocco. We are happy to report that this goal has been met, and the health center is beautiful. Here is how it came to pass. In July of last year, we conducted a groundbreaking ceremony in Minocco together with the Bishop of the United Methodist Church in Sierra Leone and other local dignitaries. We simply took it on faith that enough funding would emerge to keep the project moving. That same month, we held our second annual fundraising event and offered those in attendance the opportunity to sponsor various portions of the construction plan. Through your generosity, the complex began taking shape. By November, the foundation and block walls had been completed, and by January, the plaster was being applied and the structure was ready for the roof. In March, the latrines and water well had been dug and the main building was nearing completion. Finally, in May, we were in Sierra Leone for a week, which culminated in a dedication ceremony on June 4th, 2010. It was a very special day for the entire community. Most of the national leadership of the United Methodist Church and even the press were in attendance. There was singing, dancing, and speeches. Lots of speeches. After the keys were handed over, Doris Acton did the honors and cut the ribbon, allowing the local residents to stream into the building for inspection. The next morning, we opened for our first operational day in the new building.